The Supreme Court ruling on President Obama's health care reform law is expected this week. Regardless of how it rules, experts agree bureaucracy is not a good thing for consumers and doctors. For more now, we turn to Dr. John C. Goodman, a senior fellow at the Independent Institute. He's also the author of a new book, Priceless, Curing the Healthcare Crisis. Dr. Goodman, the court is widely expected to strike down all or part of the president's health care law. What will that do to our health care system if the law is overturned?
Well, it would be good news for almost everyone because the Obamacare legislation is a Rube Goldberg contraption that was put together by special interests, and it's designed to benefit special interests, not the American people or the healthcare system. So that would then give us the opportunity to reform healthcare in the right way.
Well, there's no denying that healthcare is becoming more and more expensive all the time. Liberals say that's why the government needs to control it. You would disagree. Tell us what your thinking is and why.
You know, the primary reason we have a problem with growing healthcare costs is because of the government. It's after we got Medicaid and Medicare that healthcare spending just really shot up. And so it's government spending on healthcare that is the primary reason for the very high rates of healthcare inflation. To get it down, we need to employ the marketplace and get competition in healthcare and real prices the same way we observe these things happening in other markets.
Now, you mentioned free markets, and you talk about that as part of the solutions in your book for healthcare. Explain why you believe health savings accounts are the answer.
Health savings accounts allow patients to control more of their own healthcare dollars. When they're controlling those dollars, they make more prudent, conservative decisions on the buyer side. And then on the seller side, when patients are controlling their own money, doctors and other providers start competing on price. When they compete on price, they also compete on quality. So if you want the market to work, you need to first empower the consumer.
Now, you say both sides of the political spectrum are misguided when it comes to our healthcare system. Where do they both go wrong?
Well, they're both heavily invested in the notion of third-party payment, which means insurance companies or employers or government paying most of the bills, when the real answer here is to empower the patient. Let patients control their own healthcare dollars, and you'll have a real market with real prices, real competition, real efficiency.
Now, what about all those people without health insurance and people with pre-existing conditions? Isn't it the compassionate thing for the government to step in there?
Well, the worst thing we can do is to believe that the way you make healthcare accessible to low-income people is by making it free at the point of delivery. When healthcare is made free, you have rationing by waiting. And the most difficult obstacle that low-income people on Medicaid, for example, face today is they can't find a doctor who will see them. So they have to turn to the hospital emergency room, where they wait many hours for their care. I would like to see us take all that money in those programs and let the Medicaid enrollees enroll in private insurance. I would like to see us have a refundable tax credit available to every American, so that everybody could purchase basic catastrophic care, and I think we could do that for a very reasonable refundable tax credit.
Okay, let's go back to those health savings accounts. Aren't they complicated for Americans to figure out?
Well, the law is complicated, far more complicated than it needs to be, but we find with our own employees, and my experience with other employees is that once they get an account, once they understand how it works, and once they understand the money is their money, they're a very valuable asset.
All right, Dr. John Goodman, thank you so much for your time. Much appreciated.
Glad to be with you.